How's it going? And welcome to another episode of Hanging Out with Nolan Hong. And of course, I am Nolan Hong, being joined by my co-host, as always, Dr. Emmett Bean. You can follow him on Instagram at Dr. Emmett Bean. And of course, our super producer extraordinaire, Jamie. And we are live right here. Well, I'm live. You're listening to this taped at the Pop Creative Media Studios. And today we have our guest, Dr. Lenny Cocco. Now, for those of you who don't know, Jamie had a concussion earlier. Well, you know what? I explained how we know him and the whole crazy story. So just trust me. Listen to this podcast. Your mind is going to be blown. It's fantastic. And we'll kind of get you caught up to date with who Dr. Lenny Cocco is and all that stuff in this actual interview. So enjoy. Here's our episode with Dr. Lenny Cocco. We've come to see you because of your chiropractic work.
Yeah.
And the thing that made the most impact and was the craziest experience was when Jamie got her concussion.
Yeah.
So we had seen you before that for other things.
Yeah.
Of course, like sore neck and things like that. But this one was where we were getting pretty worried and frustrated because Jamie was, she had a minor concussion. It wasn't a major deal. Her son Wes hit her in the head by accident.
Yeah.
And for like 2 weeks, the sensitivity to light and sound and the fatigue and all that was not getting any better. And we were just 2 days away from going on our trip that we had planned for like almost a year to London.
Wow.
And nothing had gotten any better. And the doctors were telling her, I don't think you can go on this trip. So that's when we called you up and we're like, I don't know if you can help with anything related to this. And you said, oh, I know I can do it. And we're kind of like just hopeful, but not too sure. Like, well, what can chiropractic work really do to help with the conditions of a concussion?
Yeah.
And it was an instant. As soon as you adjusted Jamie's neck, I mean, she just, you heard her go, oh, and then all the lights weren't as bright, the sounds, and she was just instantly healed.
Yeah.
And so from then on, we're like, okay, there's something really crazy about what you do. So wanted to, talk to you about your practice and what you do, but I know that there's tons of other great stories as well. But for those who don't quite understand what you do, because I know it's chiropractic work, but I've seen chiropractors before, and it's just, oh, my neck is sore, adjust, see you later.
Yeah.
Ice it. But yours is there's a different philosophy to it, it seems. Like even the way that you test out and see what is ailing me. Like sometimes I'll come with a sore neck, but you're like, oh, your stomach's been giving you trouble, hasn't it? And it's like, how do you know that? And you're just feeling around these different points. So can you explain what exactly you're doing and what this is that you do?
Gosh, maybe I don't know if I can explain this. No, I can. Yeah, I can. Well, yeah, I always, I've been practicing chiropractic for 32 years now. And I'm still blown away by what occurs after I adjust people. Like I have my analysis and I have, or diagnosis, whatever you want to call it, of how I'm going to adjust people. And you're right, I'll explain that in a minute. But then I adjust people and, not all the time, but a lot of times, miracles or their life changes or certainly their pain or their stuff goes away. And I'm like, holy mackerel, like did that really happen? Did I really do that? Was that me? And I've been doing it 30 years and I'm still like blown away by that fact. In fact, a couple of years ago, I was asked to give a talk at one of the chiropractic associations and they kind of wanted to know how many adjustments I'd done. And I'd done over 1 million adjustments.
Wow.
Yeah, because, I had a full-on practice for a bunch of years, so I'd seen a lot of people. And then some of the things you guys don't totally know about me, but my main gig was teaching seminars to chiropractors, and then I would adjust all the chiropractors in the room, which was 100 people or so, 80 people. And so,
holy smokes.
They would just line up, and I would adjust them all,
You're like the Benny Hinn of chiropractic.
Yeah, no, I didn't do put my hand on and they fall down.
Sent people reeling back into the audience.
No, that didn't happen. But, but it was really funny. I mean, that's common at a chiropractic seminar where, everybody gets adjusted. That happens all the time. So that's not uncommon when you go to our seminars. So, or any chiropractic seminars for that. Everybody wants to get adjusted.
Yeah.
But, so what I do is a technique called zone technique. Mm-hmm. And like all chiropractors, I mix and match it a little bit. I the person that I know that sent you to me, Pete Goldman, is a purist zone healer, zone technique chiropractor, and I'm not a purist, but I pretty much do the zone. The zone is basically broken up into 6 different categories, and you test along the back of the head to see, which category that you want to adjust. And then, it's based on, like, say, you had some, I think, digestive area,
Right.
and so I pushed in the area of the back of the head that was related to the digestive area, and then I knew not only what I was going to adjust at that point, but also that there was some things going on in your digestion. And it's another aspect of this is that what blows me away is that it is like 99.99% accurate. I could feel the back of someone's head and I can tell them physically what's going on, mentally what's going on, emotionally what's going on, and spiritually often what's going on. And I'll say something to them and people are like, nah, you're full of crap, forget about it. And then they'll come back like another visit and they'll say, I thought about what you were saying and dang, you were right on, And so I don't ever hold back from what I want to say, but I also don't say that I never try and be 100%. I don't want to be right. I don't care about being right or wrong. I just say what I say. And then if it's right, great. And if it's not right, that's okay. Because I just want to relay the information that I'm receiving from your body.
Right.
And I don't have a stake in being right or wrong about it. But what I know, again, after doing it for 30 years, is that I'm right a lot of the time.
So what is it about the back of the head that is why that area, as far as being able to tell you what's going on?
Well, because all of the nerves from your head goes into your spine through the back of your neck.
Oh.
And so they'll be a little bound up, they'll be a little tight, they'll be a little tender. I feel it more of like a mushiness. People might recognize the word trigger point. There'll be little trigger points in these different areas. And so when you find the most sensitive trigger point, it's also a little mushy generally, and it's got a little fibrous feel to it. So I push on it and people go, ouch, ouch, So that's why. So I'll pick, the zone that I want to work on. And then, in the brain, the brain controls the body, right? Mm-hmm. And so there's an area of the brain that controls the hormonal system, the digestive system, the circulatory system, the nervous system, the endocrine system, all of that. There's an area of the brain. So what I do is I adjust the spine to affect the area of the brain, because I can't get to the brain. Right. My hands can't. I'm not a psychic healer, so I can't dig in. I can't dig into the brain and affect the nervous system. So I have to affect the nervous system somehow. And so I adjust the spine to stimulate the nervous system in the brain to heal your digestive system. But at the same time, that's also probably where your spine is out as well. So it's causing maybe low back pain, maybe neck pain, extremity pain, because all the nerves of, say, T8 will maybe cause some tension in the mid-back, but that also may have something to do with the hormonal system, like that, relate it like that.
So is it related in that, say, there's something hormonally wrong, and that's why it'll send your back out of alignment, or is it that your spine went out of alignment, and that's what's causing the hormonal problem?
Yes.
Oh, okay.
Yeah, which one came first?
Yeah.
If you and I could figure that out, we'd be multi-gazillionaires. And I don't really care which one came first, personally. I keep messing with the mic. I don't really care. It doesn't matter to me. I, at some point, tried to figure that out, which one came first. But it almost doesn't matter to me which one came first anymore. It does not matter to me which one came first. What I do know is there was a correlation. Mm-hmm. And so, and I'm not the scientist, so let's get a scientist to figure that out. But I'm, again, completely blown away that I see the correlation. I adjust based on my correlation. The mid-back pain goes away. The endocrine system clears up.
Yeah,
and there it is,
Yeah, because in my experiences, like when I went to see, usually when I've been to other chiropractors before, it would be like, oh, my neck is sore. I think I slept on it funny. And they'll just shake my head around, crack it into place and such. But with you, you'll have me lie down and you'll feel around those points behind my neck. And I'll feel a noticeable, like very sharp pain or real sensitivity. And you'll say, oh, is this area, this bothering you? I'm like, yes, it's very painful.
Yeah.
And you're like, oh, sounds like this is related to your stomach. Are you having digestive issues? I'm like, yeah, how'd you know that? And then you'll do your adjustments, and then you'll then test that spot again, and then I'll notice a noticeable difference where, oh, it's not as painful, not as sensitive.
Yeah.
And it's crazy that adjusting the spine and the neck would affect that little, it feels like a nerve or something, yeah?
Yeah.
And so that's why I always would go to you after those experiences going, okay, there's something more to than just, oh, my neck is out of alignment or something, that this is a whole body type of effect that this is going on here.
Yeah, yeah. In fact, at one point in my practice, more people came to me for organic stuff than back pain. Like digestive stuff, hormonal stuff, circulatory stuff, nervous system stuff. Then they came for low back or neck pain. So that was an interesting
that's
thing
kind of
in my practice.
Yeah. That's our friend Vince Krause.
Yeah.
He sees you weekly.
Yeah.
And it's just to maintain and keep the body going. He's really into that kind of whole body kind of organic thing, right?
Yeah, and I get adjusted weekly as well because I use my body a lot. I use my mind a lot, and I use so I just use my body a lot. So I figured as long as I'm still using my body a lot, I better, keep it functioning 100% properly. So I get adjusted, I get acupuncture, I get massage, I do all those, I exercise, I eat well, and I do all the things to maintain a pretty good physical body. And then, the mind is better, everything just works better all the way around.
So what about, there's people who say like, oh, don't get chiropractic work done too often because you're going to cause problems like arthritis and things like that. What do you say to that? Because
they don't know what they're talking about.
Yeah?
Yeah, they really don't. Yeah. Now, there is a case for being over-adjusted. Mm-hmm. I agree with that. Like some people suggest, 3 times a week for a really long time, and then they get over-adjusted as well. So there is a case for being over-adjusted, but your own body, and your own, if you're going to see a chiropractor and you're doing some regular care, you'll know if once a week is good or if once a week's too much, or, so after a while you kind of get a sense of, I know me, I'm pretty tight because I really have abused my body in the past with martial arts, with football and track and running and just everything I did. I'm really tight, so I like to get adjusted once a week just to maintain and actually, continue to expand my health. But some people who are looser, more relaxed, do lots of yoga. I do a lot of yoga too, but it doesn't seem to loosen me up any. Yeah, well, maybe I'm a lot looser. It'd be way worse if I didn't. But, maybe they come, I like regular. So what's your regular pattern? Is it once a week? Is it once a month? Is it once every 2 weeks? Whatever you kind of get that. And if you go beyond that, then you'll get too many adjustments. Mm-hmm. And you can, I think, get too loose, too much,
Yeah.
But almost nobody does that.
So is the thought behind doing it regularly that your body's just constantly going out of alignment for whatever reason? We can't figure out what the reason is, but that your body's constantly in some form or shape getting out of alignment?
Yeah, I don't do alignment.
Oh, okay.
Per se, like there's a bunch of philosophies in chiropractic, and one of them, and I think the most common philosophy is alignment, and that's what it's easy to talk about alignment, and so a lot of chiropractors do that, and then they show X-rays, again where they can compare alignments and say, look, you're out of alignment. So I think that. But I think that for me personally, that never made sense to me, because if you look at my alignment, I've been out of alignment for my whole life, And yet I function really, really well. You know, I mean, I've done lots of sports and dance and lots of stuff and function really, really well. And so I figured it had nothing to do with me being out of alignment. I don't have any pain. I don't have any neck pain. I don't have any pain anywhere. And yet, again, if you look at my posture, you look at my quote-unquote alignment, I'm way out of alignment. So how do I look at it? I look at it from mostly a place of movement. So the technique that I've studied and perfected is called motion palpation. Beside the zone is motion palpation, where what I do is I look at the joints, and if a joint is stuck, if a joint's not moving, then what I want to do is enter a force into that joint. Use the bones as levers to enter a force into that joint and adjust that particular joint so that it starts to move better. So function determines structure. So what I want is for people to function more better than for them to quote unquote be in alignment or be out of alignment, or to have a better posture, because posture again is kind of relative, really. I mean, people have so many injuries and so many things that they're working at that, you know, you see people's postures and yet they don't have any pain.
Oh, yeah, that's true.
You know, and so I don't look at posture so much. I look at movement. Where are they stuck? And if they're stuck, that's where their energy is going to push into. That's where they're going to have their pain. I get them moving. I get the vertebra moving. I get whatever joint is stuck moving. And then they feel better. And then, so I always say function determines structure. So as they feel better, they're able to stand up straighter, and probably their posture will change too, but not all that much.
What are some of the more, I guess, interesting cases that you've had? Like you've mentioned sometimes it's like almost like a miracle happened, and even you're surprised by it.
Yeah.
What are some of the more memorable cases that you've had?
Well, I've got a killer one, but I'll tell you that one next. But
okay.
The simple stuff is like people come in to see me and they go, well, I know I'm at a chiropractor's office, and they come in because my neck hurts, my low back hurts, you know, something hurts like that, you know, and so when they fill out the form, they fill out, you know, neck pain, low back pain, you know, blah, 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 whatever. And they don't mention ulcer. They don't mention, you know, their right ear isn't hearing as well as their left ear. They don't mention, you know, that their right eye is cataract, or that they can't see as well, or they don't mention, you know, heart palpitations, or they don't mention even more stuff, you know, crazier stuff, you know, you know, prostate stuff, all kinds of number of organic, you know, ailments that happen to people, you know. And then I adjust them, do my thing, I adjust them, and their ulcer goes away, their eyesight gets better, their hearing clears up. All these wild, like off-the-chart things that are happening, you know, epilepsy, seizures, heart palpitations, heart pains, you know, shortness of breath. I mean, all kinds of weird things that they don't even put on their piece of paper go away. And I'm like, that's chiropractic. That's what it is.
It's funny because this famous fighter, Boss Rutan, he came down when I used to own a store called Fighter's Corner. He came down as our guest, and he saw and was a huge you know, a proponent of Dr. Pete Goldman. And he said that Dr. Pete saved his life because he said that he had suffered from asthma his whole life. And when he started seeing Dr. Pete cured his asthma. And I was like, how do you cure asthma from chiropractic adjustments?
Asthma's almost a no-brainer. Headaches are no-brainers.
How does that relate? Because for us who just know chiropractic as like, let's just adjust the spine. How does it...
I already explained that. You know, there's an area of the brain that controls the lungs, right?
Yeah.
And if that area of the brain, if you can affect that area of the brain by touching the nerves in your spine, and it excites the area of the brain that controls the lungs, your asthma, your shortness of breath, your stuff will go away.
So is it that your brain is healing itself?
Ask Vince what his story is with Pete. I just found this out, what Vince's story was.
What was that?
I'll probably kill the story, but I'll tell you, I get it clarification with Vince, but Pete just told me that how they met was 2002, and the reason why I know that is because I met Pete in 2002 as well, and Vince was he was a professional skateboarder at the time, and he was also, I guess, doing some martial arts, and his sensei, his teacher, had an accident and couldn't drive. And he wanted to go, he had heard about Pete, and he wanted to go see Pete. So Vince, who before that had a skateboard accident and hurt his head, and he was out of balance, seriously out of balance, and had to use a cane to walk.
Oh.
But he could drive. So he said to his teacher, he said, why don't I drive you to the office, because I can drive. I can't walk very well because I need to use this cane, but I can drive. So he drove his teacher to Pete's office to get adjusted. And when they went into the office, Pete was there to see the teacher. I don't remember his name. Pete told me, but I don't remember. And he adjusted him. And then Pete looked at Vince and said, what about you? You got a cane,
Yeah.
We can adjust you too. And he goes, oh, no, I'm not here. The doctors told me I'm like this for the rest of my life, blah, 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 et cetera, et cetera. And so Pete said, what do you got to lose? Lay down, let's do it. And so Pete did his thing and he walked out without a cane.
Oh, wow.
And so that's when Pete and Vince became good friends. And then, Vince brought him over here to Hawaii and he started seeing some of his friends over here. And that's how you met him. And, like that. So that was the miracle that happened for Vince when meeting Pete.
Yeah,
and again, science and, doctors, other people can tell me, oh, you're a quack, you're a scam, blah, blah, blah. I've read articles about that. And I was like, well, explain that to the 50,000 people out of the million that have had crazy miracle things happen in my practice. I don't really care, actually, I mean, my intellectual mind is like, I have no idea what's happening. I really don't. I don't really need to investigate that because I've just watched over the course of the last 30 years, people walk in with something, they walk out with nothing, And yeah, lots of adjustments that people walk in, they walk out and nothing has happened, or very little or minor, whatever. That's true. That has happened. But so often, crazy things have happened.
So you said you're going to tell us your killer story.
So my killer story is kind of a wild one. I was adjusting this woman, and blah, blah, blah. She was a patient of mine. She had a baby, and I hadn't seen her for a year or so, and she had a baby, and I hadn't heard anything about the baby or anything about her because she was out of my world a little bit. I saw her in the middle of the street. This was in Oakland, and long story, but I ended up seeing her there was a divide in the middle of the street. So she was crossing the street one way, I was crossing the other way, and we met in the middle of this pretty busy street. But there's it wasn't like we were in the middle and cars whipping by us. It was a pretty big divide, so we were kind of in this, there's plants all around and stuff. So we were there. And I said, oh, what's going on? And she said, well, here's my baby. I said, well, tell me, how's the baby, and let me see, And she said, it's not good. The baby's been crying every day for 16 hours. Ooh. And it originally gained some weight, but now it's been losing weight. It's like 2 months old. And we've been to Stanford. This was in, the Bay Area. We've been to Stanford, the tests, and nobody knows what's going on. So I'm a chiropractor, right? So I didn't know what to do. So I put my hand, just talking to the mom, I put my hand on the baby's neck.
Yeah.
And also, let me just say this, that many chiropractors, and I'm not totally one of them, but I figured if a lot of people know something, I might be wise to follow that. So a lot of chiropractors think that the atlas, the top vertebra, is like the most important bone in the body. And so again, I don't really adhere to that philosophy, but I figured if so many people think it is, there might be something to that.
Right.
So I figured, what the heck? I put my hand on this kid's atlas, this 2-month-old baby's atlas, while I was talking to the mom, not thinking about adjusting it or moving it, just because I needed something to do. And as a chiropractor with the atlas, I figured, if I can just soothe it a little bit, I literally had my fingers on that kid's head like that, and while I was talking to the mom. And by the way, I knew that she trusted me. It wasn't like I was, let me just grab that kid, I knew the mom trusted me, and, and I trusted her, you know what I mean? So it wasn't like a weird thing that I was touching the baby. Let's say that as well. It's kind of like because the worst thing I see a pregnant woman, everybody walks up and puts their hand on the mom. I would never do that. I would always ask permission. So the same thing. I didn't just walk up and grab the kid. Let's say that. So I had my hand on this kid's atlas, and I don't know, just part of me, I was just kind of like really gently rocking it while I was talking to Mom, and she was telling me the story. 16 hours a day, the baby cries, it's losing weight, the doctors can't see anything, everything's normal, blah, 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 but here it is 2 months in, and like that. And again, I was really gentle, and then I moved it one way, and the vertebra went pop.
Whoa.
Really loud.
Oh my.
And I was like, can I swear on this? I was like, I just killed this freaking kid.
Oh my God.
I didn't say that to the mom. Yeah. I like broke out into a sweat,
Yeah.
I was like, oh my God, this was not good, but that was it. Kid slept for 72 hours. And from that moment on, normal.
What?
Normal.
Easy.
Normal. Kids, now the kids, I don't know, 30, that was early on in my practice too. No, it can't be 30. I'm 32. It's probably 26 or 27 now.
Wow.
I don't know. I've lost contact because I'm in Hawaii now and stuff. But that's my wildest miracle.
That's scary and then awesome.
Yeah. Thank God it was awesome. Yeah. Because, but yeah, and it didn't, I'm telling you, I did not put force into it. So it just needed I can't believe that she didn't slap his back and that didn't happen or, something like the doctors doing the tests didn't put it back in, or something, but maybe it's the intention, maybe it's, whatever. So what does it? What heals? What does what makes it work?
That's insane.
You tell
when
me.
you were feeling, could you tell it was abnormal in any way or just?
I wasn't doing that. I wasn't like I wasn't like even diagnosed. I wasn't like in that mode. I was just in that mode of trying to soothe this kid, And again, I figured the atlas, top vertebra, I was just kind of like well, maybe I could soothe that area just a little bit. But I wasn't like in that mode of, because if I wanted to adjust the kid, got to come to the office. I wouldn't want to do it professionally, bring him in the office and really get a good look at it, but there it was. So that was wild.
Yeah.
That was wild.
Did the mother know that you had, could she hear?
Oh, she was like blown away too.
Yeah.
Oh yeah, we both like looked at each other and thank God my mouth stopped and I didn't say, I think I just killed your kid, because my head went, there goes my practice, there goes my life, thank you very much, it was nice knowing y'all, I'm going to jail.
Was the kid crying at the time?
Not loud, it was just being uncomfortable. You could see the kid was not happy in his mom's arms. And kind of squirming, wasn't crying at the time, but it was not happy. Yeah. But the legs dropped, the arms dropped, the kid, boom, like just dropped. And that's what made me think something bad, because it just dropped. Everything dropped into total relaxation. It was instantaneous. So that was wild. That was totally wild.
Do you have any memories of like the strangest thing someone has come to you to get fixed and it actually
strangest?
Because to me, Jamie seeing you for her concussion is strange because it's not a typical thing, right? Yeah.
Although no, it's more typical than you think because lots of car accidents. It's not like they hit their head and get a concussion, but you get that. What is it called now? Contra-coup thing, where the brain kind of rattles, from the whiplash, and so they get this concussion from the rattling of the brain. It hits inside because the brain is just sitting in a fluid in the brain in the head. So if you get a big whiplash, it hits the front, hits the back. That could cause a concussion. So chiropractors actually see a whole lot more concussions than not, than people think. But they don't necessarily happen from getting hit the head. They get hit, they do the whiplash thing, and that's what causes the concussion. So I'd seen my fair share of concussions. Yeah. But also, and I think I talked to you, Jamie, about this, many of the symptoms of concussions are actually more shock symptoms.
Right.
And so people have a traumatic experience, and do they get a concussion or does their body just go into shock over the experience? And shock often mimics some of the concussion symptoms.
Right.
And chiropractors can get people out of shock easily.
Yeah.
Well, let me say it another way. Chiropractors can move the symptoms of shock along in an expedient fashion. So they don't necessarily take the shock symptoms away immediately, but what they do is they relieve a lot of the shock symptoms, and then they progress out of those symptoms much more rapidly than not. Because shock usually takes like at minimum 30 days to kind of clear up, whereas if you get adjusted, it might take 10. It'll just start the healing process faster.
Yeah, if you could explain a little bit about as far as Jamie's condition, because we told so many people about the story because everybody had seen how bad she was. She was wearing 2 pairs of sunglasses and like inside and just looked like someone had just beaten her up and she just couldn't move. And then the next thing you know, she's sending pictures from London, catching the subway and posing in front of Big Ben. And everyone's like, what happened? You look so terrible just like 48 hours ago. And we tried to explain to them what you had told us, but we're not that educated, so we just like, oh, he's this miracle guy. He just snapped her neck back into place and she was fine instantly.
Yeah.
But in her case, do you remember like what you explained to us as far as how you were saying something to the effect of you felt that her concussion symptoms were actually gone already, but what she was suffering from was shock. And you explained it to us how that came about and what exactly was going on.
Well, yeah, almost what I just explained was that, your body was freaked out that you had that injury. And so that's shock. And so when the body goes into shock, you see these symptoms which mimic concussion in a lot of ways. A lot of people in car accidents get into shock, or a lot of people that have, like, say something traumatic happens to them and their body goes into shock. So what are shock symptoms? Tired but sleeping a lot, or agitated, or I should say, this energy, this high energy, but yet you're sleeping a lot. You feel tired and energetic all at the same time. It's almost like a real nervous energy, headachy, but not like, you can't like point to where the headache is, eye sensitivity you had, hard time swallowing, sweating, but, skin sensitivity, shortness of breath, shallowness of breathing, maybe even heart palpitations, shock symptoms, stuff like that. The irritation is very present. You can push the button really easily.
Oh yeah, we had that a lot with Jamie.
Yeah. People are irritated. And yet you're sleeping a lot and you're kind of relaxed. But yet your nerves are on edge. That's the shock. The nerves are on edge. So just anything that puts the nerves on edge are kind of those symptoms. And so if you can affect those symptoms, you can affect the healing pretty fast. So I think as I said, I thought your concussion was healed and your body was just in serious shock, which is why I was kind of confident that what I was going to do was going to help you. Because if we can take some of those shock symptoms away, you can really get help pretty fast.
Yeah, it was crazy. It was instant.
Yeah, because concussion
she walked out, she was totally fine.
A concussion is a bruising of the brain.
Okay.
Well, an adjustment's not going to fix a bruising of the brain per se, but it will take the shock symptoms away. Look, if the blood's not flowing to the brain, that's another thing that happens in shock, is that the blood flow is constricted to the brain. So you're going to have, that's why you have the hearing. Oftentimes the hearing is affected, the eyes are affected, because of the blood flow to the brain. So you can get the blood flow flowing a little bit better by the adjustment. You'll take those shock symptoms away pretty fast. And so for me, when people come in from traumatic stuff, the first thing I want to do is take away the shock symptoms so that the body can, then it can, because people come in with shock symptoms and say, oh, I got neck pain. We remove the shock symptoms, and now they're saying, well, I came in with only neck pain, but now I have low back pain. And it was like, well, because your body was confused. It didn't know what pain you had. So it was only feeling the most prominent. It wasn't feeling what's really there.
Wow.
And so that's why when people come in for one pain and it starts moving around, if they're not educated, they think I made their low back pain worse. Oh, you fixed my neck pain, but my low back pain's there, And I'm like, that low back pain was there, but I forget what the word is. but the body feels the most painful thing, and as you take away the most painful thing, then other stuff starts to. So the low back pain was always there, just that the neck pain was the most thing that was pressing. So that's why you felt that the most.
Right.
I forget what that word is, but that's what the nervous system does.
It's kind of like that thing where if you stub your toe, you bite your thumb to change that.
Yeah. People say they have a knee pain. I say, well, can you take away my knee pain? I say, sir, when I whack him on the left leg. I say, how's your right leg? Oh, my right leg is fine, but my left leg's killing me. Yeah, well, and that's true, actually.
Yeah.
You can take away a pain in a certain area of the body by creating pain in another area of the body.
And it's just more pain.
It's more pain.
So what got you into this field of work? Because you said you've been doing this over 30 years or so.
Chiropractic?
Yeah. How did you fall into this line of work?
Well, and falling into it is apropos. What I wanted to do for a living was I wanted to coach track and field.
Interesting.
I was a runner. I was a track runner. High school, college. That's what I wanted to do.
What was your expertise in?
Hurdles. I was a hurdler.
Wow.
Intermediate hurdle. 300 meter and then 400 meter hurdler in college.
Holy
so I was way back in the day when the high school was 300 meter hurdles, and I was really good. Blah blah blah. State went to the States. All that stuff. So I wanted to be a coach. And by the way, of course, my track coach in high school was phenomenal and changed my life. And then my track coaches so I had these mentors in the track that, really affected me in a big, big way. And so I like to teach. Obviously, I like to talk. You can get that, but I like to teach. And so I always thought, let me say another thing. I did not like academia. I didn't like school.
So we're on the same page there.
Yeah,
I think that's why we get along so well.
I wasn't a bad student, and I'm certainly not stupid, which I found out later, but I just didn't like school, and I was the ADD kid. If I was in school now, I'd be on all kinds of drugs, Ritalin. I can't say I wasn't a bad kid, but I was the boy pulling the girl's hair, saying the stupid thing. I was that idiot kid in the back of the room. I admit it. Hi, my name is Lenny. I disrupted your class. Yes, I did. But I just had a lot of energy, and I didn't want to sit still, and blah, blah, blah. So I wanted to be a track coach because I didn't have to sit still to be a track coach, But back in the day, in order to be a track coach, you had to be in academia. Mm-hmm. Back in the 70s, you had to go on to get a master's and then probably even a doctorate in order to. So then you didn't teach anymore, but you got equivalent, credits. You were still like a teacher on the same pay scale as a teacher, but you were doing coaching. Yeah. You know what I mean? I think I explained that right. Mm-hmm. And so I just couldn't see myself going through all that academia and masters. There's no way I could stay in school that long. But I still wanted to be a track coach. So what I was doing was I was selling insurance to make money. And the reason why insurance was because I could do it part-time or half-time, or I could make up my own hours, and still coach track. Okay, so here I was tracking the women's track team at Southern Connecticut State University. And it was awesome. I was an assistant coach, doing the hurdles and sprints and stuff. And my brother went to chiropractic college. And so he'd come home on vacations and he'd come over and adjust the girls. And he would adjust them, and what I noticed is their knee pain went away, and their ankle pain, shin splints, all this stuff would go away. And I was like, wow, that's crazy. And so he'd say, this one kid, I just adjusted her fibula or tibia or whatever. I want you to do this, and he would show me how to shake the fibula, so it would stay loose in that tibial fibular joint near the knee, and he'd say, I did this on the ankle. I want you to just kind of pull the ankle every day or for, 3 or 4 times over the next week or whatever. So I would do it, and I was like, wow, I really like doing that, I like pulling on, I like doing the simple adjustments that he showed me. He didn't show me anything complex, but I was like, that's really cool. And as he came back more and more and more, I started doing a little bit more and more in terms of what I could do. He showed me some trigger points for shin splints. I did that, et cetera. And before you knew it, I was on my way to chiropractic college.
Now, is your brother older or younger?
He's younger than me.
Oh, interesting.
Yeah, he's 2 years younger than me.
And did he
He is a great chiropractor. He's in Connecticut. He's still practicing. And he is a great chiropractor. He's a chiropractic neurologist.
What is that?
So, chiropractor, but then he went on to study neurology with other chiropractors, and it's a huge study. I mean, it's not like, a weekend course. I mean, it's a huge commitment to time and study, and he's more of the intellectual type, like can study and read and all that stuff, Yeah. If it isn't on a video, I ain't learning it. No, I can read now, but he likes school. He likes to study. He's more of the intellectual approach to car. Like when I tell him what I'm doing, he's like, get out of here, go away, because he, again, approaches it more from an intellectual perspective. And so what I'm doing with the zones and touching the back of the head, he thinks is a little bit of frou-frou, but he wants me to adjust him all the time, right? Yeah. And because I'm a good adjuster as well, and he's a great adjuster. Well, now that remains a story with my mother.
Oh, yeah?
So my mother had heel spur, and my brother Mike was adjusting her for the heel spur, and he was doing some laser on the bone spur on the heel, and he was doing some, I think he had one of his PT people in the office do ultrasound on it as well, which is kind of a prescribed treatment for bone spurs, and but it just was not getting better, and it was like many, many, many months. And my mom is a big, active, walks 5 miles, she walks a lot, so she was really being hampered by this. So I lived in California, they were in Connecticut. He was doing this, and I was talking to my mom, and she just kept telling me about her bone spur. And I said, well, when I come back, I'll adjust it and take care of it. And my brother heard that, and he was like, yeah, we're adjusting, we're taking care of it. So Christmas time comes, I fly back to Connecticut. I get in, and my mom says, can you adjust my ankle? Can you adjust my bone spur? I said, sure, come on, lay down, let me adjust it. And my brother was there, and he was like, look, I've been doing it, it's not getting better. We got to probably get on for surgery. And I was like, well, let me just see if I can do it. So laid her down, I did my thing, checked her head, did all my blah, 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 adjusted everything I could, and then adjusted her heel. And I adjusted it, the way I do it.
Yeah.
And she got up and her bone spurt was gone. Gone. Had no more heel pain. It was gone.
Like instantly.
And my brother just hated me.
Are you and your brother pretty competitive?
Just because I always win? No.
So there's no competition.
No. He hates me. I always win. That's the worst part. Like he always had to study his butt off in school, and I got the same grades and didn't study, and oh God. No, we are competitive, but we also get along really, really well. He's a great guy. We're actually pretty close. But he was so flabbergasted that I did my thing, and he was just looking at me going, oh, this is stupid. What are you doing that for? He didn't say it out loud, but
you could see it.
I could kind of hear it, in the room, and she got up and her heel pain was gone. Well, I really believe, that many heel spurs, not all heel spurs, it's not true that it's all of them, but, the Achilles tendon goes down and attaches underneath into the heel, like it sends some fibers down into the heel, and if the Achilles tendon is really, really tight, it's going to pull some of the soft tissue off of the heel. Mm-hmm. And so it'll look like, act like a bone spur. And maybe even if you take an x-ray, there may even be a slight bone spur, but I contend that if you take an x-ray of any 80-year-old person, they're going to have a bone spur. Just like if you take an x-ray of any 80-year-old person, they're going to have arthritis in multiple places in their body. Mm-hmm. Now, do all of them have pain? Not all of them. Many of them have pain. I mean, like my mom always says, getting old is not for the weak, because she has some arthritic pain, but we x-rayed her neck, and her neck is pretty okay, in terms of pain, but yet she's got arthritis all up and down her neck, Mm-hmm. And same with the bone spurs on her heel. I think that bone spur that they x-rayed is not going away anytime soon. But it is not symptomatic and hasn't been now for 10 years. She walks 5 miles a day, plays golf, blah, 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 and her bone spur doesn't hurt her in the heel.
Yeah. Wow.
I don't know. What's that?
Well, that's what you're talking about. It's like it doesn't matter what it is as long as you know how to fix it or that it's better, then it doesn't matter if it's there or not, right?
And I don't even know if I can fix it. I'm not even going to come in saying I can fix that.
Yeah.
What I am going to do is I'm going to do my thing, and I've done it so many times now that I'm going to do my thing, and that a good portion of the time things are going to get fixed.
Yeah.
And you can't ask me how. I don't care how, actually. I'm not the scientist. I'm not the intellectual. Those things are for somebody else to figure out. I'm the one that does the adjustments.
That's probably why your brother hates you, too, because he's probably the one that likes to know
He likes to know. Yeah,
and then here you are doing all this stuff, and I don't even know how it works. Just do it.
Yeah.
He's like, oh,
Yeah, and he wants to study it. And he has had some research stuff in his office and blah, blah, blah. And I don't care about the research. Now, he's a great chiropractor. And he's had the same results. I mean, he's had amazing, as a chiropractic neurologist, he sees a lot of people with PTSD, ADD, ADHD. I mean, that's actually one of his little specialties is that kind of stuff. You know, and concussions, like real full-on concussions, and really severe epilepsy stuff. Brain stuff. As a chiropractic neurologist, but he does no drugs, no meds. He does it with the hands. He does it with chiropractic.
Amazing.
Yeah, and it's pretty cool. It's very cool. And when he tells me about it, I'm like, wow, wow, wow. And I go, oh, I should go study. And I think, no. Rejected. Yeah. When I finished chiropractic college, I couldn't even read the newspaper. I was like, I am done reading, man. Studying for like 2 years, I couldn't even read the paper.
So after that, did your mom always say, oh, Lenny, you're my favorite son now?
Nah, she's more PC than that. No, but that is bragging rights.
Yeah.
I still bring that up at dinner table.
As you should.
For sure, as I should, yeah.
So you went to chiropractic school after this experience with your brother and when you were coaching.
Yeah.
And you just went straight into your own practice, or what kind of?
Yeah, and I thought I would go and become a track coach again. I thought, I'll become a chiropractor and then go coach.
Right.
And what was interesting was I really never had. I loved chiropractic so much at that time that I never went back to coaching. I actually kept just doing my own practice. And I'm a maverick. What can I say? I did a lot of interning with many chiropractors, but I wanted to do my own thing. And because I found that chiropractors were doing, they were, at the time, remember this was in the early 80s, so the insurance stuff was very prominent at that point. Now it's not. Now, the insurance is all who knows what it is,
Yeah.
But at the time, you could go and open up a practice and do, car med pay, medical stuff for car accidents, for work comp accidents, and then also health insurance covered chiropractic, $100 deductible, 80/20 copay, so it got paid a lot. So chiropractors were doing a ton of insurance work, and they made a lot of money, and they did really well. Well, me personally, I don't like filling out paperwork, so again, that was kind of like that intellectual thing that, people said, well, just hire somebody to do it. And it just all felt complicated to me.
Yeah.
And I was in the insurance business. I knew what insurance was, and I just didn't want to participate in insurance. So I always did a strictly cash practice, even from the day one. And everybody said, well, you're going to make less money. And I was like, that's fine. I'll make less money. Truth is that I probably did make less money. I mean, that's probably true. But I made really, really good money, and I only had one staff person instead of 3. I just never argued with any insurance companies. I just never had that. So I went into my own practice because so many chiropractors wanted me to. Their whole practices were to go into the insurance stuff, and I didn't want to do that. I wanted to go cash.
Yeah.
And that's what I did from day one. That's what I'm still doing. That's what I would always do.
So what was it about the chiropractic work that you fell in love with?
Easy. I mean, that's easy. You adjust people, they get better. They pay you, you make lots of money. Then they refer a ton of people to you, so you get even more people to adjust and they get more money. And then I only worked 3 days a week.
Really?
So I had this crazy lifestyle that was ridiculously awesome.
So what kind of things did you do on your off days?
Well, that's a great question. I had a kid with another chiropractor who we were studying anatomy and physiology together. We actually didn't get married, but we had this child together. But we were good friends, actually still are to this day, because, she's my daughter's mom, so we see each other a lot, and we're very close. But we decided, after many discussions, to have the child and raise the kid and blah, blah, blah. And so, and that was really early on in my practice, really early on, like from day one. And so she was a chiropractor too, or going to be. She was still in school, actually. I worked Tuesday, Thursday, Saturday. She worked Monday, Wednesday, and Friday. And the off days, we took care of the kid.
Wow.
So that was like from day one in my practice. So that was kind of why my lifestyle. So what did I do? I raised the child. Raised my daughter. She's 28. She'll be 29 in a couple of weeks now.
And where does she live?
She lives in Orinda, Oakland, Bay Area.
Oh, okay.
Bay Area, yeah.
Because that's where you were.
That's where I was.
Okay,
I was in Oakland.
Gotcha.
Yeah, my practice was in Oakland. Yeah. And so I basically hung out with my daughter, which was cool. Yeah, which was really cool.
And then you were also really active with martial arts as well. Was that during this time too?
A little before. Well, in Connecticut, I was active with it.
Oh, I see.
Judo, jiu-jitsu, and then when I came to California, I got even more active with it. I loved this teacher that I was working with there. He was also an acupuncturist, and I got pretty involved with him doing that stuff. And it was just, I'm very physical. So I ran every day, did yoga, did martial arts, all this stuff, And then when I was 39, and of course I remember exactly the age because, going 39, going on 40, still doing martial arts, still doing all this stuff. And I was very active, and we were training, some kids, some young kids, and I had a severe injury in judo. I severed my psoas muscle.
What?
And severing a psoas muscle is hard to do.
Yeah.
But essentially, I had my legs wrapped around this guy, and he was so strong, he basically ripped my legs apart.
Oh my God.
He was young, 6'2", 245. He was in great shape, not an ounce of fat on him. And he just, and anyway, so I went from all of that exercise to not being able to walk. And I should have had surgery on the psoas, but I decided, I'm a chiropractor, I can heal it, which was probably the dumbest thing I did. But in my life, if I have a regret, that's the one I should have had the surgery, replace the, that's the only, I should look back on that and go, wow, that's a surgery I should have had. So I ended up not being able to walk for pretty long time, and then with a cane, and gained some weight, got out of shape, blah, 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 and then I ended up having both my hips replaced because I had a frozen joint. My right hip got frozen joint, and then it was really painful. So at 39/40, that was it. I was done. Now I'm 62, 22 years later, but I was done basically with martial arts, with I just couldn't do it anymore, So now I've had both my hips replaced, and here I am.
It's funny because you mentioned 39. Jamie just turned 40 a few months ago.
Yeah.
And literally the day she turned 40, all these things started falling apart. She started getting tendonitis in her foot, and her
wait till you get 60.
Popped out.
Yeah, like my mom says, getting old is not for the faint of heart,
So you were originally in Oakland. What brought you to Hawaii eventually?
Well, so I went from Oakland to Sonoma. That's a long story, but the short version is I wanted to get into the country, and so I commuted for 7, 8, 9 years to Oakland to do my practice, but we had a home, a 10-acre farm in Sonoma. And kind of at the same time, I'd cut my practice down some to only 2 days a week, Tuesday, Thursday, and started teaching seminars to chiropractors all over the country.
Oh.
So mostly in the West, but a lot on the East Coast as well. And I would do between 20 and 30 seminars a year. Means, so like I would do my Tuesday, Thursday practice, and then Thursday night jump on a plane, or Friday morning jump on a plane, fly to whatever, go to a hotel, teach my seminar. I did it. At those days, basically most chiropractors needed 12 hours of continuing education. So let me back up a little bit. I did this course called the Entrepreneurial Edge, From Vision to Profit, Having It All. It was a course basically to teach entrepreneurs how to do their business. And we used to do Friday night, all day Saturday, all day Sunday, and then Monday morning course. It was a huge commitment all throughout the weekend. I mean, it was unbelievable. So chiropractors had to do these 12-hour seminars, and I thought they would do, a lot of them were doing like this 6 or 8 hours on a Saturday, and then another 4 or 5 hours or 6 hours on a Sunday. And I thought, man, I'm doing like 14-hour days, Saturday and Sunday in this other course. And then I went out and decided to do this continuing ed. Let's just do 12 hours in one day. So I came up with the idea of doing 12-hour continuing education course in one day. We started at 8 o'clock in the morning, ended at 8 o'clock at night. Nobody else was doing it in the continuing ed field. So I was massively successful from it, just from that perspective. Like, yeah. I don't know if they liked my seminar or not, but they liked doing the 12 hours in one day.
Yeah.
Get her done was kind of the expression, So I was really successful. So I went from, my practice to teaching seminars, and I would do between 20 and 30 seminars a year, traveling around the country. And again, I would leave on Friday, teach all day Saturday, come home on Sunday, and then get ready to do my practice all over again. My daughter was older, so, she didn't want to hang out with Dad on the weekends anymore, like that kind of, that whole scenario. It was perfect timing kind of thing. And so now, teaching these seminars all over the place, and I'd come here twice a year. I'd always come to Honolulu twice a year. So, and I would always do it on, Kuio, at the Hilton.
Oh.
I was a Hilton guy, so I always taught my seminars always at the Hilton, because then you get points and you get free rooms and, free beers and, whatever, you get these points,
A good deal.
Yeah, it was always a good deal, yeah. And you're doing 20 a year, you got so many points, you got lots of perks,
Yeah.
I always flew everywhere for free as well because of all the miles and added up and stuff, Anyway, so I was coming here twice a year, and every time I came here, of course, my wife had to come with me at the time, and we would say, man, if I were going to retire someplace, that's where I'm going to retire. So it'll be 5 years, September 18th, so like a little over a month, it'll be 5 years that I've moved here. Wow. When I retired, I said, I'm going to Honolulu. That's where I'm going, because I loved it here. I loved coming here. And so there I was. I moved here 5 years ago. I wanted to be near the water. I wanted to be on the islands. And I love living here. I'm glad I did.
So while you say you're retired, but you still practice from time to time, because of course you've seen us and you see Vince, but
only friends and family.
Is it because you just that love for helping people and
I like to do it. I totally love to do it, and I like to help people, and Do you still do seminars and such? Do people still ask you to come and talk? And I do not. They've stopped asking me. For a couple of years, they asked me a lot, and I said no so many times that they've stopped asking me at this point. But I would, but maybe not. I don't know if I would or not. But I'm pretty much done with the seminars, the traveling and all that.
Yeah.
And then I did a whole lot of stuff over the phone. I was telling Jamie earlier that then from my seminar stuff, I went into coaching chiropractors. Mm-hmm. And I had a huge coaching practice with chiropractors. So that was what I did on like Mondays and Wednesdays. I was coach chiropractors on the phone. And then I did the podcasts. And then I did, go to meeting stuff, for, seminars on the phone, and had the website, chiroschool.com, all that stuff. And, I did a lot of that. Yeah.
So for the most part, you're pretty much retired, and
for the most part,
how are you enjoying that? Because it seems like you seem to be the type of person that's always doing something. You said you're very active and like to always be involved in doing things. So how has the retired life been for you?
Yeah, it ebbs and flows. I can get too busy, but I'm pretty active now. I'm really exercising a lot. I do the hot yoga almost every day. And that's in Kaimuki, so I ride my bicycle to Kaimuki, which is about a half-hour ride. Then do the yoga, which is 90 minutes, and then a half-hour ride back, and then I get in the pool for a mile in the afternoons, and ride my bike some other times, and then stretch a little bit at night. And so I'm definitely pretty active doing that stuff.
Yeah.
And I still coach a few chiropractors on the phone. Actually, I coach entrepreneurs now. Oh. I've branched out from other, not just doing chiropractic, but I'll coach entrepreneurs. And I always like to say my coaching is life coaching. But this term that I've been hearing a lot lately, which is emotional intelligence. Uh-huh. I mean, I didn't really know what that meant. And I didn't really know that that's what I was doing. But I think I coach people more on how to be more emotionally intelligent. That's more what I coach people, because I think, again, I never look at myself as being the smartest tool in the tool shed, but I do look at myself as being successful. Mm-hmm. And I am successful, and I think I'm more successful because emotionally I'm secure and stable, and I'm, and so I can be persistent, I can be consistent, I can be, regular in the things that I need to do to be successful. And that's more what I coach people, is how to have the mental mind frame to be that persistent, that consistent, and easy. Like, I'm not saying I'm persistent and push. That's not my makeup. If it ain't easy, I ain't doing it. It's a phrase that I like to use. And so I coach people on how to be emotionally intelligent with ease and effortless. That's my coaching.
Not that you can explain it all in one thing, but for those who are interested in what the philosophy behind that is, like, is there one of the tips that you like to push towards people that people don't think about in becoming?
Well, I could say, you are, if you're an entrepreneur, you are your business. Mm-hmm. Yeah. And so if you're feeling good about yourself and you're confident in you, your business will be successful. And so it's way more about you mm-hmm. than it is about all that work that you put in to be successful, in my opinion.
That makes total sense.
So in a nutshell, I want you to be appreciative, to be happy, to be successful, feeling successful about you, and then your business will, express that. You'll be way more successful.
That we subscribe to that for sure, because Jamie and I, we have our own business here, and we noticed that once we start having that mindset of being positive and appreciating the opportunities and feeling confident in that we're good at what we do, it seems like it almost like a light switch happens, and start getting these calls and all these projects that we've always wanted to work on start coming in, and people it's infectious. And then when we talk to them, they get excited about their business and things. So
and what I always like to say is out of the blue, right? As I roll my eyes, it's out of the blue, it's like, it ain't out of the blue, man. Things happen when, as a chiropractor, if I was, I could look at the schedule, and, my wife and I are fighting, I'm kicking the dog, which I've never kicked the dog. That's a figuratively. That's a figuratively, yeah.
Emmett's
wife's fighting, kicking the dog, drinking the beer, swearing at the road rage, Again, none of that happened. But, you get what I'm saying.
Yeah.
Basically in that cranky place, I come in and it's like, gosh, all these people canceled for the day.
Yeah.
I'm like blown away how many people would cancel for that day. They don't want to be around someone who's cranky, right?
Yeah.
It was like cause and effect, man. I'm cranky, they go away. Now, did I call them up and say, hey, I'm cranky today, don't come in? Right. But the airwaves, man, tells them, don't come in to see Lenny today, he's cranky. And when they came in, would they notice I was cranky? No, I always put my game face on. But, something to do with the energy. Again, I can't explain it. You're somebody else out there who's listening is the scientist. You guys figure it out. All I know is that it happened so many times.
Yeah.
That if I was off my game, me personally, Lenny, was off my game, my schedule got, people would cancel. And if I'm on my game, it was like, couldn't keep them away. There was no way I could keep them away. So that's what I coach. A good phrase too is how to stay on your game, how to stay powerful, positive, high vibrational, feeling good, confident, appreciative, about yourself.
I think we found another thing we need to come see you about, because that is exactly what we always talk to each other about, almost like every other week.
Yeah.
But man, I really want to get better at being more confident, more appreciative.
Yeah.
And we see that when we are successful in changing our mindset like that, how much of a positive effect it has, not on just business, but in our lives and in our relationship
everywhere.
with each other and other
Raising
people.
the kids, with the family.
Man. Big,
Yeah, I look at it like when my mom treats me amazingly well. Mm-hmm. And, let's forget mom, family. I remember, they're from Connecticut, the East Coast, and they used to. One of the reasons I moved to California was because I just disliked I'll be general, and this is way too general, but I'll say it, and then I'll come back and clean it up, I think. I just felt like I was always kind of out of, on the East Coast, I felt like I was always out of me, I was a fish out of water, is the phrase I was looking for.
Yeah.
And I felt like my brothers and sisters were teasing me all the time. Actually, my friends were always teasing me. It was that East Coast tease, or that East Coast kind of grading tease, I moved to California. Didn't know that I was trying to get away from that, but I moved to California and I was like, whoa, my friends were way different. The teasing wasn't there, mostly because they weren't my intimate friends. The intimates tend to tease you more, like that, So now I'm in California learning, and then I went to therapy and learned about this, teasing, and learned about how to love the self and appreciate the self and all the things you just said. And I did all that and really healed myself around my confidence in me, my love for me, my appreciation of me, the fact that I am smart, I am good, I am clean, all that stuff, right? I went back to the East Coast, and lo and behold, my mom couldn't tease me anymore. My brothers and sisters never teased me anymore. It was like they couldn't push into it.
Yeah.
When they would do it, there'd be no reaction. So it was like there was no fun for them.
Oh, yeah.
And I didn't really get the cause and effect really, but it was like I saw how they treated me completely differently than how they used to treat me because I wasn't in the same game anymore.
Right.
That's when I started really seeing that. So that's why I started coaching people a lot about that as well. So I've coached a lot of people how to go back and be with their families in a way more powerful way. And then all of a sudden it's like, wow, my mom changed. It's like, no, your mom didn't change. You changed. So she has to treat you differently because the buttons aren't being pushed the same way. So they don't try and push the buttons anymore. I'll tell you, I had a really great experience with this with my ex-wife, who we still get along really well. She's a great woman, but we definitely split. We saw our paths go the other way. Mm-hmm. We were doing this right thing. I'm right, you're wrong, kind of thing, the power struggle kind of thing. And we were right in the middle of it. It was pretty within the first 5 years of our relationship. We were really in the middle of this, right. And there's a phrase that I learned in this coaching thing. You want to die right or you want to die happy. And we were kind of in the middle of exploring that phrase, right or happy, and I was definitely in the mode. I have to give my wife, I give her a ton of credit. I'll tell the story because it's really apropos and people will hear this. But I was the one, man, that I was going to be right.
Yeah.
Period. My heels were dug in. If she said blue, I said red. If she said night, I said day. If she said light, I said dark. I was right. And I was going to be right. And I was going to fight to the last inch of being right. I'm not proud of it. Just is what it is. Anyways, we were on vacation, and we were driving down this street, and these new homes were going up, and I said, wow, those houses are big. And she said, no, they're small. Look at how small they are. And I said, they are really big. So we were doing this whole
Real important stuff here.
But this is how it goes in relationships, right? You really get into this really important stuff.
Yeah.
You know? You fight about these really stupid things, just to be right.
Yeah.
You do. I'm blown away by how dumb it is, but we do. I jammed on the brakes of the car. I did a U-turn, and my wife was like, I can see, she was like, what the hell is he doing? I turned around, I pulled into the driveway of this house. I was getting out, I said, I'm going to go ask them what their square footage of the house. This is a true story.
Oh my God.
I was going to be right, and I was going to be proven that I was right, God damn it, I was like this, going to knock on the front door, and she said, I'm looking at them, they're really big. Pulled my hand away. I said, see, I was right. She goes, they're really big. It's funny, this is a true story. I got back in the car, and she goes, you're right, those houses are big now that I'm seeing them. And it was like a shift, because from that point on, she made me right about any time it was a blue, yeah, it's blue. And, it's white, yeah, it's white. It was like, she just gave it up, completely gave it up. Well, time went on, 2-3 weeks, maybe a month, I don't know how long. Well, I realized that I can't be right all the time. She's got, you know what I mean? So like it got me off my rightness as well. And she would say something and go, I can see your point in that. You're right, And it was like this whole, so she really shifted it. I was dug in. I wasn't going anywhere. But when she shifted it, we shifted. And that's another thing. And the same thing with my mom. When I shifted, my mom shifted. My brother and sister shifted. And so that's like a really clear, I think, distinction for people.
Right.
When she got off the rightness, I had to. I had no choice. I mean, I stayed stuck for a while.
Yeah.
But I'm not stupid, so I started to see how I can't be right all the time. So that was very powerful.
Yeah.
And that's another thing that I coach people on. Well, where are you pushing into something, where, and you're not getting the results you want, maybe you're pushing too hard.
Right.
So people are kind of backing off, or, they're, like that.
Yeah, I think it's our nature as humans that when we want something changed, we try to change the other person.
Right.
Instead of looking at yourself like, how can I change to make the situation change, right?
Yeah, I always laugh and say I got married, so I had someone to blame all my stupid stuff on. Right, well, how dumb is that? Who is the common denominator in 5 marriages? No, I didn't have 5 marriages. I only had one, but
seemed like 5.
Yeah. It was 20 years of marriage. But who's the common denominator? So you're right. People
see, now he's doing it to me. He's telling me I'm right. No, you're right.
Yeah. And I think the same thing is in your business. If you're a person that this is the way it is, I think you have to have some of that, some of defining your business and defining your business model and defining your vision and your purpose and all that for sure. But then you also, can't be stuck on that, because so people come and they want to be with you in a way, that works for them too.
Yeah.
So it can't just be all one road, one way. There has to be some flexibility in that. So, that's kind of my philosophy. I think if you were to lump it in, that's how I coach people.
I would subscribe to that for sure, because like I said, we're starting to figure that out on our own.
Yeah.
And there's so much, I think even in general, just for people, not only just business owners, but in dealing with family and personal, like this philosophy works on all levels.
Across the board.
Yeah.
I mean, even with your dog, just across the board it works. Yeah. So to me, it's just amazing how, let me see if I can get rid of that. Yeah, it's just amazing how, you clean you up and your business is successful. I watch it happen to me all the time. I mean, it blows me away, actually.
Well, I thank you for always cleaning us up and helping us. And you've just blown us. Every time we see you, you always impart some new kind of knowledge or inspiration to us, not just for what we came in to get physically fixed, but just mentally and spiritually. So I knew it was going to be a really great time having you here and hanging out, and you did not disappoint. And we really, really appreciate you taking time to share with us your story and all of these great philosophies that I think we all can take with us and impart in our lives.
Yeah, cool. Well, I did it because I know who you are and Jamie, and I feel completely comfortable, and so I know that you guys are really wonderful and really great. And, so I had no, because people have asked me in the past, to do stuff, and I'm like, oh, I don't know you, you know what I mean? But when you asked, I was a yes, instantaneous, because I know how great you guys are. So it was an absolute no-brainer for me to come and be with you, and and whomever is listening, I know they're all going to be great because if they're listening from you guys, so it's a win-win-win.
Oh, thank you.
Yeah, thanks.
All right, our thanks to Dr. Lenny Cocco for hanging out with us. And what I tell you, wasn't that crazy? He has such a great history and life, and what an inspiring guy. And I hope you walked away from this episode being entertained and enlightened with what Dr. Cocco had talked to us about. Speaking of entertained, me and Jamie just finally had a chance to see Spider-Man Homecoming, and it was amazing. So, I don't know. Jamie said that she had some friends on Facebook that said it's all right. Whoever you are, if you thought that Spider-Man Homecoming was just all right, then something's wrong with you, because that was one of the best Marvel movies I've ever seen. And in fact, I think I want to go see it again tomorrow. So check yourself. But in all seriousness, thank you so much for tuning in. We had a great time, and hope you enjoyed this latest episode of Hanging Out. We'll catch you on the flip side. Peace!